I've been using Replenish for about a year now, um, and I've realized the benefits to my clients. Many of them come back with very positive results. So my name is Dr.Gakuo Karuga. I'm an ENT specialist by profession. So I've been practicing for the last about 8 years as an ENT specialist. But as a medical practitioner, I've been practicing for about 16 years. I have a joint practice here at Prodigy Medical Services, which is in KMA Center, on the third floor. Also have a practice at City Health Hospital, which is in town, an Odeon Cinema on the first floor. How I got to know about Replenish. A friend of mine who's a gynecologist, we're having a chat and I was explaining to him how my mother's having problems with arthritis and having a lot of pain. She's not very mobile and struggling. So he told me, why don't you try Replenish? It works very well, and even gave me some data, some information, a lot of downloads, which I really appreciated. So I got some of it and I gave it to my mom and I told her to try it out for a month. And after a month, when I went to visit her again, she was so excited. She told me that now she's able to take walks, she's able to do house chores, which she was not able to do before. And she was really impressed by how the product worked on her. So then I realized that it's actually quite a useful product. I went and looked at the literature again and found that it has other uses which can be useful for me in my practice. I found that it's also good in things like allergic rhinitis, it's good for asthma, it's also good for any other inflammatory disease that my patients may have. Also have patients who have immunosuppression who can benefit from it. So since then, I started applying it in my practice. I have prescribed it for patients who have asthma, who have allergic rhinitis, also encounter patients who have arthritis, cervical spondylosis. And so far, I'm actually quite happy with the results. There's a client I was seeing, and he had asthma, and he has been having a lot of problems. He's been using his inhalers every day, that is both bronchodilators and steroid inhalers. So I gave him the Replenish for a month. So when I reviewed him last week, I asked him how he was doing, and he told me, "Do you know, doc, since I started using this Replenish, I've not touched my inhaler. I've not had any asthmatic attack since." So I was very happy for him. I also recently reviewed a patient who uh, presented to me with neck masses, enlarged submandibular gland, neck pain. So during our investigations, one of our concerns is whether the patient has also retroviral disease, which is HIV. And actually, after testing, we found that she's actually HIV positive. And these were actually manifestations of the viral infection. So because she had a very high viral load, it was affecting her glands, causing inflammatory processes throughout her body. So we started her on the antiretrovirals and also on Replenish at the same time. And what we found is that actually, with the treatment, even the glands, the salivary glands, the size is reduced with time. Initially, she thought she needed surgery, but after reviewing her 2 months later, she didn't even, there were not any significant swellings in the neck. So we felt that she didn't even need any of the surgery anymore, and that was quite an impressive effect. Actually, I recently had a patient who we diagnosed with retroviral disease, and we started them on antiretrovirals, and also started them on Replenish at the same time. We checked their CD4 counts after six weeks or so, and we found a major jump in the CD4 counts. So, okay, well, as a combination with the antiretrovirals, I believe it really assisted the patient to develop a better immunity very quickly. So nowadays, even when I get patients in my practice who have immunosuppression, as I treat the primary cause of the immunosuppression, I also give them a Replenish supplement, and I find that the improvement is way quicker when I combine the two. My recommendation is there are many, so to say, conditions which this product would be very useful in. especially any inflammatory conditions. So things like, you see, like allergic rhinitis is basically an inflammatory condition, asthma, uh, things like arthritis, different types of arthritis. And also, of course, if you want to boost someone's immunity, and that can be useful for someone who has uh, retroviral disease, that is HIV, or anything else that is causing immunosuppression, it will be very useful for boosting the immunity.